Hello friends, welcome to MedLab Learner, and today we will study 25 important MCQs in hematology, important for lab technicians and technologists. Let us begin with question number 26. Which is not seen in hemolytic uremic syndrome spontaneously? A. Coombs test positive, B. Thrombocytopenia, C. Hypofibrinogen, D. Uremia. Answer will be A. Coombs test positive is not seen in hemolytic uremic syndrome. 27. Preservative used for storing blood for transfusion is A. SAGM, B. Citrate, C. EDTA, D. CPDA. Answer will be D. CPDA. 28. How long can be blood How long can blood be stored with CPDA? A. 12 days, B. 28 days, C. 35 days, D. 48 days. Answer will be C. 35 days. 29. Which is not a complication of blood transfusion? A. Hyperthermia, B. Tetany, C. DIC, D. Hyperkalemia. Answer will be A. Hyperthermia. Hyperthermia is not complication of blood transfusion. 30. Raised serum ferritin is seen in A. Leukemia, B. CRF, chronic renal failure, C. Rheumatoid arthritis, D. All of the above. Answer will be D. All of the above. 31. Autoimmune hemolytic anemia is seen in A. AML, B. CML, C. CLL, D. ALL. Answer will be C. CLL. In chronic lymphocytic leukemia, autoimmune hemolytic anemia is seen. 32. The most diagnostic test for SLE is A. Complement fixation test, B. Antibodies against ANSL, C. Anti-dsDNA, D. Antibodies against nucleus. The most diagnostic test for SLE. This is very important question. The answer is anti-dsDNA. 33. Lepra cells are A. Neutrophil, B. Lymphocyte, C. Histocytes, D. Plasma cells. Answer will be C. Histocytes. 34. Phagot cells are characteristics of Phagot cells are characteristics of A. AML-M1, AML-M2, C. AML-M3, D. AML-M5. And phagot cells are seen in M3 stage of AML. Answer will be C. 35. Fatty change in liver is seen with the use of Fatty change in liver is seen with the use of A. Tetracycline, B. Erythromycin, C. Chlorpromazine, D. Acetoaminophene. Answer will be A. Tetracycline. 36. The best anticoagulant for osmotic fragility test is A. Heparin, B. EDTA, C. Trisodium citrate, D. Potassium oxalate. And the best anticoagulant for osmotic fragility test is A. Heparin. 37. Plasma cells are increased in A. Rheumatoid arthritis, B. Acute appendicitis, C. Bronchitis, D. Blisters of burnt skin. Answer will be A. Rheumatoid arthritis. Plasma cells are increased in rheumatoid arthritis. 38. In Reye's syndrome, following biochemical changes are seen except A. Moderate elevation of SGOT and SGPT, B. Hypoglycemia, C. Hypoglycorachia, D. Hyperuricemia. Answer will be D. Hyperuricemia. Hyperuricemia is not seen in Reye's syndrome. 39. The replacement of red marrow by fatty marrow in bony cavities start at the age of the replacement of red marrow by fatty marrow in bony cavities starts at the age of A. 1 to 3 years, B. 4 to 5 years, C. 6 to 9 years, D. 9 to 12 years. Answer will be B. 4 to 5 years. 40. The anemia associated with leukemia is A. Iron deficiency anemia, B. Megaloblastic type, C. Myelophthic type, D. All of the above. Answer will be C. Myelophthic type. The anemia associated with leukemia is C. Myelocytic type. 41. Dithionite test is done for assessing. Dithionite test is done for assessing A. Hemoglobin F, B. Hemoglobin E, C. Hemoglobin S, D. Hemoglobin C. Answer will be hemoglobin S. Dithionate test is done for assessing hemoglobin S. 42. Color index. Color index of blood is A, B, C, D, and the answer will be C. Color index of blood is 0.9 to 1.0. 43. The most reliable marker of body iron store is the most reliable marker of body iron store is A. Serum iron, B. Serum ferritin, C. TIBC, D. Transferrin saturation. Answer will be B. Serum ferritin. The most reliable marker of body iron store is serum ferritin. 44. Blood smear is best stained at a pH of 7.2, 6.6, 6.8, 7.0. Answer will be C. 6.8. 45. Hess test is done to assess. Hess test is done to assess bleeding time, capillary fragility, clotting time, prothrombin time. Answer will be B. Capillary fragility. वीडियो बनाओ रुको रुको अस्सी 5 मिनट बात करो करो Hess test is done to assess capillary fragility. 46. Which is abnormal in classic hemorrhagic disease of newborn? Which is abnormal in classic hemorrhagic disease of newborn? A. Platelet count, B. Thrombin time, C. Fibrinogen level, D. APTT. Answer is D. APTT. APTT is abnormal in classic hemorrhagic disease of newborn. 47. A false positive sickling test may be found in A. Recently transfused blood, B. Infected blood sample, C. Hemoglobin C, and D. All. A false positive sickling test may be found in D. All of the above. 48. ESR depends on ESR depends on A. Viscosity and fibrinogen, B. Rowlex formation, C. Verticality of tube, D. All of the above. Answer will be all of the above. 49. Which is abnormal hemoglobin? A. Hemoglobin A, B. Hemoglobin A2, C. Fetal hemoglobin, D. Hemoglobin C. And the answer will be hemoglobin C. And the last one, in CLL, chronic lymphocytic leukemia, basically which cell predominates? T lymphocyte, B lymphocyte, monocyte, all. Answer will be B. B lymphocyte. In CLL, B lymphocyte predominates. Friends, thank you. Thank you and subscribe.